Hello, Dr. Kumar, and welcome to a bit of content on Get Healthcare, where essentially I'm going to ask you a few questions and people can send in questions if they have any. Thanks for joining us.
Thank you very much, Dylan, for having me on.
Great stuff. I'll get started on our first question. This is for people in Ireland who haven't used online GP services before. How does a video consultation actually work in practice?
Actually, this video consultation or telephonic consultations are very, very convenient, which can be done at your own time, at your own ease, at your own place, where you are sitting. You don't have to make an appointment with a routine GP, which will not be there straight away. It will take some time. I think these things picked up quite nicely during COVID, like when people were not allowed even. So that was the things when HSC helped as well to put all these things online. So many people still prefer to get only telephonic consultations, but some may like to have video consultations. But definitely, it is a very preferable way of dealing with the problems at the moment. Yes.
And from a practical process, so you just join the video call and you just engage earnestly and.
Yeah, you're right. We have to identify that ID first.
Yep.
Right, by name and date of birth or address. And then we'll have to find out the GP as well, because for continuation of care, that consultation, copy of this consultation should be sent to the routine GP as well. The only problem is when many of them do not have any GPs, then we can't help anything more than that.
Yeah.
But if somebody has a GP, then yes. And in consultations, like there are plenty of other websites as well, but our website is working all right with this consultation and very convenient. Yeah.
In the instance where someone doesn't have a GP, it's not a mandatory requirement to give a GP, is it? Like if you don't have a GP, you can use the online system. It does seem to be an issue that comes up frequently. There's like a lack of GP care in Ireland, so it does seem to be a lot of our customer base are people who actually can't get GP care.
Yes, you're right. GPs are always in scarcity. So even if somebody wants to register with them, it's very difficult to get registered where the GP is agreeable, because all the lists are full. So we don't blame even GPs because they are overworked anyway. So, but it is not a mandatory to have a GP. It's just if somebody has it, then for continuation of care, we can send the consultation to them, but it is not mandatory.
What types of health issues are genuinely well suited to online GP care, and when should people still go to an in-person option?
Yeah, see, for online GP consultations, most of the time the things which can be which can be cleared or get better within the next 3-4 weeks, not as a long-term problems, like short-term problems like upper respiratory tract infections, chest infections, back pain, sometimes stress, all these things. If they're not lingering it on, then it's very good. But once or twice they can always come back to us, and then we can help them out either by medical cert or by consultations, whatever is needed. But if it is lingering on like few times in a very quick succession frequently, then they need to be seen in person by GP. Yes.
So initial consultations essentially can be managed online, but if any sort of issue persists, best to go in person.
Yeah, definitely. If it's frequently coming, then one has to find out that what is the cause that somebody is getting frequently that type of problems. Yes.
Physical examination then is
some blood test, physical examination, all those things like more.
As time passes, we're going to be doing at-home testing, stool, blood. We have urine as well. Do you think, what percentage of care do you think can be done online, and what percentage of care needs to be done in person, just as a future concept?
Yeah, as a future concept, it is a good idea to go through all those things. Now, there will be few problems coming in the way for that as well. But again, initial consultation and with some blood test is not a bad idea. But again, problem is that with the online and this one, you can't have all the tests done or plenty of tests done. So there are chances of missing anything or something. So it's always better. I mean, whatever we can do initially, and then we can take it on from there, and person can be referred to hospital for the further follow-up. Like in-person GP blood test has quite a lot of things which can be done through the hospitals, but with online it is, we can do it only as a private patients, whatever we can do within our limits.
Yeah, there are limitations to the online health, but maybe in time it might change. From a GP's perspective, how has online healthcare changed patient access and patient outcomes in Ireland?
At least I think it has revolutionized the whole system, the GP care, especially the online one. And as I said, GPs are in scarcity. Sometimes it will take a few days to get a appointment with the GP, and for that small problem you can't even go to A&E, and O&E is under pressure as well. So this is an alternative to the normal GP appointments, which you can get it done most of the time the same day, and you can talk to the doctor, and if prescription is needed, that can be given. If medical cert is needed, that can be organized. So most of the things we can organize this thing in a much quicker succession, and while you are sitting at home or sitting at your work, which can be done. So that physical contact appointment with the GPs will be avoided for all these smaller things which we can deal online.
So do you think from a patient perspective, I mean from a GP perspective, I suppose online healthcare makes everything a bit more efficient, and it might free up a little bit of time for the in-person clinics where they can deal maybe with potentially more critical issues. So from a patient outcome perspective, it is improving patient outcome in that there might be more time for physical GPs to deal with more critical matters.
Exactly, because GPs are all dealing with this chronic disease management, which is quite time consuming. So they all are hard pressed as well with other problems. So if these minor problems and all which can be treated in a very much efficient way from the sitting at home, it will be much more helpful to the GPs as well, and to the healthcare system as well.
Yes. Okay. Fantastic. Okay. Well, look, thanks for chatting with us, and we'll have another chat again next week, and we'll run through some more issues. And if anyone has any questions, we're trying to be transparent with the process. We might start going through some of the online products as well. I'll share the screen next week, and we can just run through one or two of the products and show people what it'd be like to use our system, and we can have a chat about that as well. Okay.
Thanks very much. Thank you.
Thanks so much.